Everybody, welcome back to TJ's Tuesday Tidbits. We're going to be talking today about POTS. And if you know anyone who has POTS, or if you have POTS, get a pencil out because I'm going to talk fast. All right, we got a lot of information to cover in about 5 minutes. Okay, POTS is postural orthostatic tachycardia syndrome. We deal with a lot of POTS in our clinic. Okay, so we go through these things a lot. So with postural orthostatic tachycardia syndrome or dysautonomia, people have an issue where they lay down and their heart rate's normal. They sit up and their heart rate is semi-normal, goes up a little bit, and then they stand up and their heart rate jumps up to 120 beats a minute and their blood pressure never changes. They start getting headache, fatigue, dizziness, blacking out, those types of things. Okay, so what happens with that? You have a very wide range of symptomology that occurs with this. Okay, and it's very misdiagnosed, and no one really knows how to treat it. So people go in and they start complaining about headaches, migraines, fevers, rashes, stomach pain, digestion issues, fatigue, malaise, lots of different even visual disorders, blacking out, seizures. Those types of things can all start to originate from issues that involve dysautonomia. Dysautonomia is the inability to control your autonomic nervous system. And what happens in autonomic nervous system, that's what happens with your sympathetic and your parasympathetic balances. Your sympathetic nervous system is your fight or flight, right? Parasympathetic is your rest and digest. And we start having this dysautonomia when your autonomic nervous systems aren't functioning as well as what they should. So patients go in their doctors, they don't know what's going on. They get referred on, and finally some doctor down the road does a tilt table test and maybe some more autonomic testing, and they find that once they're on a tilt table and they start to raise them up, their heart rate starts to go up, okay? And then you have, without raising that blood pressure. So now what? Well, now, maybe as a neurologist, they say, well, this is a cardiac issue because your heart rate's going up. So they refer you on to a cardiologist, and a cardiologist says, well, we can't help this, we'll put you on some beta blockers, maybe some other things, but we're going to refer you back to a neurologist. And the neurologist and cardiologist are doing this thing. It's his fault, we can't fix you, okay? Maybe they try some amitriptyline or some of those other medications trying to slow your heart rate down, okay? Sodium tablets, another big thing. Well, what do we do here? We go through and we figure out what part of the brains aren't functioning and how to work on them, okay? This is a big thing with dysautonomia. You have what's called in your neck here a carotid artery with a baroreceptor. This baroreceptor is very important in establishing blood pressure to the brain. So as pressure increases in this baroreceptor says, okay, we have increased blood pressure. This blood pressure doesn't need to go in the brain that quickly. We're going to slow the heart down, okay? So then as you slow the heart down, this blood pressure lowers, okay? The carotid artery on the right does that. The one on the left does something different. So as your heart rate slows, now all of a sudden your brain kicks on and says, hey, I'm starving for blood, I need a little bit more. Then your brain fires off and starts to raise your heart rate. Okay, well let's say this isn't as sensitive, okay, and you're not picking up the information that you need. You don't regulate your blood pressure as well, and you start to facilitate increased heart rate with it, okay? So what we do is we start to figure out what areas of the brain we can ramp up to increase that sensitization of that baroreceptor and get that to fire off better, okay? We follow all the pathways from the frontal, parietal, temporal, all the way down into the central, ventral areas of the medulla, the cerebellum, to try and ramp up that baroreceptor to get things to fire off, okay? What I see with POTS patients is we got a lot of neurological imbalances, okay? Particularly neurological imbalances involving the right frontal, right parietal, left cerebellar area of their brain, okay? When we start to ramp all those things there up together, they start doing a lot better, okay? So, what do we learn from POTS in this little bit of time? We know that's a neurological imbalance, okay? Your cardiologist probably isn't going to help a lot. Neurologist is going to find some medication and put you on, but probably isn't going to fix the problem. You need to address the imbalances that you have. Chiropractic, you know, I love chiropractors, I'm a chiropractor myself. A cervical adjustment isn't going to fix the problem. Okay? You need to address the neurological imbalances. Functional neurologists can fix this. Functional neurologists can help this tremendously even if they don't fix it completely. Okay? We've got a lot of POTS patients come in here. So if you have POTS, this is urgent. You go to your functional neurologist, the acnb.org. Again, that's acnb.org. American Chiropractic Neurology Board has a list of functional neurologists that could be in your area. Look that up, okay? If you have any questions or need to find someone in your area, we'll even help you out. Give us a call, okay? 507-425-0025, and we'll do everything we can to try and help you out. If you want to come see us, we'll give you as much work as we can to try and figure out what's going on with your POTS and calm that down, okay? FoldafamilyChiro.com, okay? Go ahead on our website. We even talk about POTS on our website. And send us an email, go from there. All kinds of things can cause POTS, okay? A lot of times it comes after an infection, particularly a strep throat with lots of heavy antibiotic use, okay? I've also seen trauma, I've seen emotional trauma, I've seen a lot of stress cause those, okay? And I've just been warned we're at 6 minutes, so I gotta go, all right? So, again, POTS, go to your functional neurologist, get all that checked out. Hope you guys wrote this down. If you have any further questions, give us a call. Thanks a lot. You guys have a great day. We'll see you next week. We're going to talk about plantar fasciitis. Thank you.